Today, we'll go over how to diagnose your liver from your foot. We will use the foot to look at indicators that you may have a liver problem. One big problem with medicine is that you have one doctor who studies only the foot, and another doctor, the hepatologist, who studies only the liver. So, sometimes you're not looking at the big picture, and you might not be able to associate different relationships. Today, we're going to do that, and the more you understand about things like this and the different associations, the more appreciation you're going to have for your body, especially your liver, and the better you're going to take care of yourself. Let's start with the purple, brown, red dots on the lower parts of the legs. These are leaky blood vessels called thrombocytopenia. This condition usually occurs with a liver problem. A thrombocyte is a platelet, they're cells that help blood clot, meaning you have low platelets. So thrombocytopenia is not being able to clot and having leaky blood vessels. This is seen in advanced liver disease and diabetes, which can be the result of a toxic liver. The next thing is spider angioma. It's a spider-like presentation of red blood vessels on certain parts of your body. And they can show up in your ankles, your foot, your lower legs, and other parts of the body. This is an estrogen problem because estrogen dilates the blood vessels. And that's why you see this in pregnancy, because pregnant women are high in estrogen. Also as a side effect from taking birth control pills and hormone replacement therapy. As well as in liver conditions because the liver helps to buffer estrogen, and if there's damage to the liver, you're going to have higher levels of estrogen in men and women. The next are cracked heels. Sometimes you get this cracked, dry, bleeding skin around your heels. That's usually a vitamin B3 deficiency. Now, a real severe deficiency in B3 would be pellagra, but you can have subclinical pellagra, which is not a full-blown pellagra with all the different symptoms, but some of the symptoms involve the skin. And so a B3 deficiency affects areas of the body where you have a higher rate of cell turnover. Like the skin, which has to constantly replace itself. When you're deficient in B3, you're not able to replace these cells efficiently, and it's going to show up in cracked skin. A certain part of your foot might have a roughened, dry, scaly skin situation that's usually low in omega-3 fatty acids. And that can come from a lack of bile because that part of the liver is fatty. Since it can't produce the bile to extract these fat-soluble nutrients, one of which is omega-3 fatty acids. This can also be caused by consuming too many omega-6 fatty acids, which are found in corn oil, soy oil, canola oil, peanut oil, safflower oil, and sunflower oil. The next one is itchy skin. This is usually a condition where the bile is backing up into the blood and the skin, because there's some type of sludge in the bile ducts, and the term for that is called cholestasis. And if there's bile in the skin, you are going to experience itchiness, often in the foot, the bottom part of the foot, or the lower part of the foot. Your urine will most likely be darker as well. Your skin might be a bit on the yellow side, especially the whites of the eyes. And your stool might be on the lighter side of the color spectrum. You also have a bad odor because one of the purposes of the liver is to detoxify the body. And so, if the liver cannot detoxify the toxins coming out through the skin, there is a bad odor coming from your feet even after washing them because of your toxic liver. The other thing about the bottom of the foot is that the person has pain and numbness, like a burning sensation. This is called peripheral neuropathy. Many times, it's diagnosed as plantar fasciitis. Your body also has insulin resistance, which eventually turns into prediabetes, and then diabetes originates in the liver. So, anyone with insulin resistance, prediabetes, or diabetes is going to have a liver problem. And the more fat and inflammation that the liver starts to develop, the more insulin resistance they're going to have, which aggravates the blood sugar situation. You might also have a condition called gout. Normally, gout is related to the kidney because the kidney filters the blood and gets rid of uric acid. But your liver has a process called the urea cycle, which converts excess ammonia into urea in the mitochondria of liver cells. Urea produced by the liver is then released into the bloodstream, where it travels to the kidneys and is ultimately excreted in the urine. The main gout symptom is pain and inflammation in the big toe and the joint connecting it. You might also have toenail fungus, which is usually caused by an imbalance of microbes. These diverse microbes should be present in your gut to protect against fungus overgrowth. And so this is associated with an imbalance in your microflora, which is also associated with the liver. And one of the things that happens when the liver is not working is that it's not able to produce the bile. That's supposed to keep the small intestine clean of bacteria and prevent overgrowth. So, a healthy liver can help prevent something called SIBO, small intestinal bacterial overgrowth, and keep these microbes in check, so you don't have an overgrowth of bacteria or fungus. The next thing you can have is corn on your toes. Usually, they grow on the inside. It can be very irritating and is caused by a vitamin A deficiency. Vitamin A is involved in the differentiation of certain cells. So, anytime you have a deficiency of vitamin A, you have all sorts of skin issues, certain weird growths that occur, dryness, or roughness. Which comes from the same thing, low bile salts. Bile salts help you break down the fat-soluble nutrients, vitamins A, D, E, and K. And a fatty liver can prevent the production of bile. Another symptom of a bad liver is that your feet become very hot. So, a dysfunction with the liver will alter the temperature of your feet. The last symptom related to the liver is pitting edema, which is when you press on the lower leg, it leaves a little dent in there. This is a liver problem. The liver is normally supposed to make certain proteins that keep a balance of fluid in your body. When you're deficient in these proteins, you start backing up with fluids. And they start to show up in between the cells, in what's called interstitial spaces, and also in the spaces around the abdomen. Usually, you see this with men who have cirrhosis, where their stomach looks like a pot belly and has fluid inside. It's called ascites or edema. Now, we are going to talk about what to avoid and then what to do if you have a liver problem. Number 1. Medications. One of the biggest problems with liver issues is taking a lot of medications. You might want to ask your doctor to find some alternatives to certain medications. Because medications have toxic effects and the liver is all about detoxification. So, reducing the load is probably going to be one of the most important things. Number 2. Reducing your intake of sugar and refined carbohydrates. The more sugar and refined carbohydrates you consume, the more fat your liver produces. Some people are not aware of the fact that the cholesterol in their bloodstream and the fat on their liver most likely came from carbohydrates or sugar and not the dietary fat or cholesterol they're consuming. So, sugar gets converted to cholesterol and fat in the body, where it ends up in your liver. Number 3. Overcooked foods. If you're overcooking your food, you're killing off the enzymes that the liver needs to help with digestion. Foods that can sit on the shelf for a long time are hard on the liver. Number 4. Alcohol. As you already know, it is a huge burden on the liver and many other parts of the body as well. If you're drinking alcohol for health reasons, then for your information there are no health benefits to alcohol. Your body has to detoxify. And alcohol creates a lot of deficiencies, especially vitamin B3. Which relates to pellagra-like symptoms, which are like dermatitis, and a lot of skin issues. Not to mention B1 deficiencies, magnesium deficiencies, zinc deficiencies, and all sorts of nutrient deficiencies. So, if you can't completely give up alcohol, reduce it as much as you can. Number 5. Junk food and fast food. The food from fast food restaurants is pretty deadly to the liver. So, instead of eating junk food, try to eat as much healthy food as possible. Number 6. You should avoid corn because it has extremely low levels of vitamin B3. And extremely low levels of tryptophan, which turns into vitamin B3 and can cause pellagra, which is a vitamin B3 deficiency. There are hundreds of foods that have corn in them. For example, grits, corn chips, high fructose corn syrup, certain alcoholic beverages, corn oil that's in a lot of different foods. As well as your salad dressing, maltodextrin, which is a synthetic sugar that also comes from corn. Popcorn, dextrose, which is another synthetic sugar present in a lot of foods. And modified cornstarch are all made from corn. And 60% of the feeds to livestock are made from corn. So all this corn goes into the animal, and you're eating corn indirectly. Now, let's talk about what's good for the liver. Number 1, if you have any problems with the gallbladder. You need something called TUDCA, which is a type of biosalt that is wonderful for the liver. It will help to thin the bile, drain all the pipes of the liver, and allow toxins to freely flow through these little pipes into your small intestine. Number 2, one of the best herbs for the liver, is milk thistle, which has special properties to protect the liver. It's used to treat poisoning from a mushroom, snake, or medication. If you take medications, you should, at the same time, be taking milk thistle to protect the liver. Milk thistle, as well as TUDCA, can help reduce fat in your liver. Number 3 is to start consuming more cruciferous vegetables like kale, broccoli, Brussels sprouts, and cabbage. These vegetables are high in sulfur, which is important in the detoxification process of the liver, as well as the detoxification of excess amounts of estrogen that build up in the liver. Number 4 is regular daily fasting, which is 1 meal a day. Because the more fasting you can do, the more good you're going to do for your liver. You should at the very least eat 2 meals and no snacks. Number 5 is doing the healthy version of the ketogenic diet. By using high quality foods that will greatly take the stress off the liver. You can decrease the fat in the liver even within 2 weeks of starting the ketogenic diet. Number 6 is cod liver oil. What's unique about cod liver oil is that it's high in omega-3 fatty acids, which are going to help the fat in the liver reduce inflammation and help break down scar tissue in the liver. That's all for today. Thank you so much for watching. Don't forget to subscribe to our channel for more information on the liver.